Pro Group Management, workers' comp that works for you.
Welcome to Nevada Newsmakers. On the broadcast today, Mason Van Houweling joins us. He's the CEO of University Medical Center, the largest hospital in Las Vegas, here for the whole show on an all-new Nevada Newsmakers.
Hello, is this D&D Roofing?
Yes, it is. How may I help you?
You did such a great job on my roof. May I speak to the owner?
I am an owner.
Oh, can I speak to your supervisor?
Sure.
How may I help you?
I love your work. May I speak to the owner?
I am an owner. We're all owners. Well, that's why at D&D we work so hard to keep your home safe and sound.
Oh, no wonder.
D&D Roofing and Sheet Metal. Local, employee-owned, here for you.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org.
Pro Group Management offers workers' comp services to a growing number of industries. As businesses grow and change with the times, the need for a solid workers' comp program must be flexible and up to date. The evolving nature of regulations can make staying ahead of complex tasks challenging. But Pro Group Management simplifies the work so your industry can move forward and succeed. Pro Group Management, workers' comp that works for you.
Truck drivers are some of the hardest working people you'll meet, delivering over 70% of America's freight and 92% of Nevada's. When there's a natural disaster, they're delivering critical supplies to help those communities recover and rebuild. Every sector of the economy and our nation's military rely on truck drivers. So let's take a moment to say thank you. On the open road or city streets, our truck drivers are rolling to make our economy and our nation stronger. Trucking moves America forward.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we're always pleased to welcome back to the program Mason Van Houweling. He is the CEO of University Medical Center in Las Vegas. Pleasure to have you back on the program, sir.
Thank you, Sam. I wish I could be there in person with you today, but always nice to see you.
Thank you, and hopefully soon enough we'll be able to be together again. Let me start out by asking you about the special session of the legislature and the liability bill that hospitals were taken out of. What are your thoughts on that? I understand that there's some folks are saying that there are already enough liability protections for hospitals already that you didn't need to be included in this. I wanted to get your opinion on that.
Yes, as you know, we've had 2 special sessions, and in this last one, there was an introduction of SB 4, which was a premise liability bill to protect those businesses, both small and large, in regards to COVID. It was interesting that healthcare facilities, to include doctors' offices, nursing homes, subacute, and hospitals, were actually excluded from that bill. But you're absolutely right when you talk to some of the attorneys and some of the folks that introduced that bill. They felt there were enough protections under the emergency order from the governor and the state to protect those type of facilities. So again, a little concerning. We would have liked to be included versus excluded, but we understand that from those government officials and lawmakers that the intent was not to penalize us, but felt that we had enough protections in regards to the emergency orders that are currently in place to protect those facilities.
Were you surprised that you weren't included, or did you know that going in? Because you're on, the governor's task force on this.
Yeah, as you know, things are moving very quickly in very short order. So I think, from a Nevada Hospital Association, we were concerned that the healthcare industry was not included in the protections of that bill. And so we had some conversations and some dialogue with both the House, the Senate, and also the governor's office. And at the end of the day, felt a little bit more comfortable with the intent but also some of the protections under the emergency order. But again, it was concerning that we weren't included, but because this virus doesn't seem to be letting up for any time soon.
So, my concern was the financial stability of medical centers like yours, because you've not been able to do the number of elective surgeries that you would normally do. You've had a tough enough battle getting University Medical Center into a fiscally good position. Do you have concerns at this point as you look forward? Are you going to need support from the federal government to be able to maintain where you are financially?
Yeah, Sam, I would say, UMC in particular was operating extremely well for our fiscal year, which ends in July. And then about mid-March hit, and we encouraged people to stay home, that could be at risk. Those businesses shut down, and so schools shut down. And so all hospitals in the state really did take a significant decrease in their volumes, both on the elective side, but also we saw a significant decline in some of our emergency room visits, upwards of 40%. Things like stroke and heart disease, we just didn't see coming in. So for several months, the hospitals were really ghost towns for a period of time. And so business is picking back up, and we're seeing a recovery. We're off about 8 to 10% from our peaks back in February and early March before the stay-at-home order took effect. But, as the business is looking different now, as you know, unemployment here is approaching 25%. Southern Nevada, a lot of individuals have lost their coverage. We've seen Medicaid applications increase upwards to 7 to 10%. So even though it's increased volume, the complement and the payer mix has significantly shifted. So I think that's going to have a financial impact on healthcare facilities over the next year or two.
And with the increase in Medicaid, that hurts you too because the reimbursements are so much lower.
Right, and in the first special session, there was a reduction of Medicaid by about 6%. So we're very fortunate that we have that coverage and access for those patients here in our state, and it's been a good thing, and especially as we've expanded Medicaid as a state, and we've seen our uninsured drop from 20 to around 9% pre-COVID. Those Medicaid reduction dollars to those healthcare facilities will significantly impact the hospitals. We've done an analysis here at UMC, and that's about a $7 million annual impact in reimbursement to the hospital with those Medicaid decreases from the first session.
You were talking earlier about the number of emergency room visits that have dropped during COVID. But my thought process is that, and I've talked to a cardiologist in the last week or so, who is saying to me he doubts that there have been any less heart attacks or other emergencies that would normally result in the emergency room. It's just people who are not going. So are we not stacking up medical problems that people who are surviving heart attacks or other what would normally be in emergency room visits, this is going to come back to haunt in the not too distant future?
You're absolutely right. And, as I talk to physicians and surgeons, that delay for several months did kind of postpone some medically necessary procedures. And so we're trying to catch up on that, prioritizing those patients, working well with our primary care doctors and our surgeons and our specialists to be able to get those patients caught up. But, when you look at that time when we stayed at home, we know that heart disease and strokes just didn't disappear in our community. We know where they were still out there. So we're just very concerned that people continue to make their appointments, don't forego care, seek out care if you have a medical emergency, because we're here to take care of you.
And this is anecdotally, of course, at this point in time, but are a lot of people still scared to come to the emergency room because they're scared that, by coming to the emergency room for something apart from COVID, they're going to end up catching COVID?
I think I see that in the community. All of our emergencies departments have done a great job of, when a patient walks through the door, identifying the symptoms and the signs of possible COVID or a person that may be suspected with COVID. So we segregate that population and have them go to another area that's got all the PPE, the negative pressure rooms, the protocols, and the respiratory therapist, and the ability to be able to diagnose those patients. separate from the other populations that may be coming in for other medical diagnosis. But we do see apprehension in the population to come into hospitals just because of the concern of coming down with the virus, and especially those that may be at significant risk.
It's been interesting to see the change in the medical industry over the last 6-7 months, because medicine is not a static thing. So the way that the doctors and the industry were dealing with patients in the beginning has changed, I would say, fairly dramatically from then to now, because you're using all different kinds of therapies, and ventilators are no longer, it appears, at the top of the list.
Yeah, you're exactly right. I think we've learned and evolved and implemented some best practice to deal with COVID-19. I think early on, ventilators were highly used. Hydroxychloroquine was utilized throughout our state. And as the doctors and the specialists have learned, it doesn't have as much of an impact as they once thought. So early intervention is key in identifying. So I think that's why testing is so important, to be able to get involved in the patient and their family, determining who's been exposed. But things like remdesivir has been working well. We've got about 15 patients here at UMC today on remdesivir, and we've got plenty of doses through the national stockpile. And that's been in great collaboration with the governor's task force and the support from the emergency response. So we're finding that intervention is helping with reducing some of the inflammatory functions that happen with this virus.
With vaccines, there is so much excitement to get a vaccine, and the government is spending billions of dollars to fund multiple different resources to get a vaccine. But in talking to people, it's kind of like the people who are prepared to stay home and not go out versus the people who are more than willing to go out. It's about 50-50. In conversation, about 50% of the people tell me, and this is again anecdotally, that if there's a vaccine, they'll be the first ones to take it. The other half are saying, well, I might wait a couple of years before I would take it. Your thoughts?
Yeah, I think, in fact, we've got some trials going on down here in Southern Nevada, a few hundred individuals that are testing some of the vaccinations, but I think that, we certainly have expedited the process. So I think that's the apprehension of the public is, are we going too quickly to find a solution? And quite honestly, will it be as effective as the influenza vaccination? And so, every year in our industry, we get excited if the influenza vaccination is over 60% effective, and we've been trying to perfect that for decades. So it'll be interesting on how the scientists evolve a COVID-19 vaccination and its effectiveness in the community. So I think the best thing is to hope for that to be expedited and be able to have an application, but we just need to continue to do all the recommendations that we're telling the community for now. And I think that'll have a big impact on the influenza this fall. And that's really my concern, Sam, is this convergence of our annual flu, respiratory illnesses layered on top of what we're dealing with COVID. So that, as a hospital operator, gives me great concern. But I think everything that we're doing, that we're recommending as far as best practices to be safe, will have an impact on both.
All right, so you make a very, very important point here, which is that, influenza is a serious killer in the United States every year. We just have accepted, because it's not a big news story every year, it's just accepted that this is going to happen. A good portion of the population does get a vaccine for that, myself included, but some years like this year, they completely miss the correct ingredients for the vaccine. So just having a vaccine is not a panacea that's 100%, correct?
Correct. And I think this year is going to be more important, incredibly important for folks to get the vaccination. We know many schools are online learning, so that should have an impact with the amount of flu that's being spread, because last year the flu did have a significant impact on children last year, more than we had seen in the past. So again, it's important to get it, and I'm glad you get that vaccination every year. I do as well, and so does all of our healthcare workers. So we're going to see how that kind of pans out for us. But it's just a concern of those two coming together and both being typically a respiratory type of illness.
All right, let's take a quick break. We'll come right back with Mason Van Howell of UMC after this timeout.
Can't do it. Stupid, like my mom.
We can't do anything at Mommy's because you won't pay child support.
Dad said you cheated, and he's not even sure he's my dad.
Mommy said you left both of us, so she isn't gonna let me see you. I look just like my father.
I'm divorce attorney Marilyn York, and I may represent men, but hate has no gender, only casualties. Please, stop sacrificing your children in your war against your ex.
Because of UMC, I'm putting my free time to good use.
Because of UMC, she keeps me on my toes.
Because of UMC and this guy, I'm here.
UMC, the highest level of care in Nevada.
The signs and symptoms of cataracts can start out small with subtle changes in your vision. So don't wait. Be proactive and take your vision into your own hands. If you're experiencing the onset of cataracts or just have questions, contact your eye care professional or call Eye Care Associates of Nevada today. Dr. Hiss has years of experience specializing in the surgical correction of eye disorders and has completed over 84,000 vision correcting procedures. At Eye Care Associates of Nevada, we'll change the way you look at the world.
Hey, Dad? Are you learning? This place is great. Huh? You gotta try this.
Wow, this stuff is great. People are gonna love it.
Yes. Yes, they will.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Mason Van Houweling. He's the CEO of University Medical Center, the largest hospital group in Southern Nevada. So you raised what is a major concern coming up for this winter, which is COVID at the same time that you have the flu coming on. So my question to you would start out with, what's your normal occupancy in terms of flu sufferers during a normal winter season?
Yes, Sam, and for us here in Nevada, hospitals are a very seasonal business. During the summers, our volumes are typically declined, some of the lowest in the entire year. I think the entire medical community got this wrong as far as the COVID-19. We thought this would act much like the influenza virus, and it would kind of go away during the summer and we'd be able to catch our breath. It absolutely hasn't, and as you know, it continues to spread in our state. But without COVID, we already get up to sometimes 95, 100%, sometimes even 105% occupancy in our hospitals here in the state. So in our ICUs and our emergency departments for those that are seeking care for respiratory or influenza-like symptoms.
All right, so does that include the people who are there for elective type surgeries that could be moved out potentially if you got a rush? Because if you had your peak influenza season at the same time you had an outbreak of COVID, would that mean that we would have to go to the center that's built down near Cashman and to the convention center?
Yeah, so in regards to peaks during the fall, which typically starts around late September all the way through the end of February, where we really get our high occupancy and high utilization and folks that are seeking care in our hospitals in the state. So and again, with COVID still out there, we are constantly looking at our surgical volume every day. Those that are medically necessary, and then some of those that may be some type of elective procedure. So we vet those out every day to make sure that they don't tie up an ICU bed inappropriately. Those patients that can come in and out very quickly, we're able to do those surgeries, and we've got some great surgery centers here in the community as well. But we're constantly trying to ensure that we've got access to the emergency department, to the paramedics and EMS, have patients that can be dropped off and cared for and moved through the system, but also ensuring that our surgical volume is not compressing on the other end. So, and then at UMC, we have so many high-level care services that we get a lot of patients that are being requested to transfer in because of our care that we offer here at UMC. So it's a delicate balance. It's going on every day. We've had our incident command center open since really mid-March to be able to help manage the throughput and the efficiency of the hospital here at UMC.
All right, let's take another break. We'll be back with Mason Van Houweling of UMC after this timeout.
Dimitri Prine here for Design Outdoor. Come visit Design Outdoor's store and backyard to see our wide selection of fire pits, barbecues, and pizza ovens, natural stone water features and fountains, and frost-proof pottery. Our store and backyard are located at 11600 South Virginia, just north of DeMonte Ranch Parkway. Visit designoutdoor.com or call us at 851-9499.
Can't do it. Stupid, like my mom.
We can't do anything at Mommy's because you won't pay child support.
Dad said you cheated, and he's not even sure he's my dad.
Mommy said you left both of us, so she isn't gonna let me see you. I look just like my father.
I'm divorce attorney Marilyn York, and I may represent men, but hate has no gender, only casualties. Please, stop sacrificing your children in your war against your ex.
Hi, I'm Dave Newman. Remember me? I used to be the house detective, and now I'm a realtor, full-time at RE/MAX Realty Affiliates. A lot of people ask me, how's the market? You know what? It's fantastic. If you're even kicking around the idea of buying or selling, give me a call. Let's talk about it. Call me at RE/MAX Realty Affiliates and just ask for the guy who used to be the house detective, Dave Newman.
Everyone is talking about opioids, but they're not the only drugs that can be harmful if taken in large quantities or not as prescribed. You also need to be aware of side effects from anxiety drugs, muscle relaxants, sleep aids, and stimulants. Mixing prescription drugs with other drugs or alcohol can be dangerous. If you take Ambien with a glass of wine, it may be enough to stop you from breathing. Prescribed drugs can be just as dangerous as illegal drugs. Take medications only as directed.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Mason Van Houweling. He's the CEO of University Medical Center, the largest hospital group in Las Vegas. Let me ask you about your staff. You guys have been working at peak efficiency, over peak efficiency, for months now. How are they holding up?
You know, the team's doing a great job here at UMC. You know, as you pointed out, we have been working around the clock, coming off of last year's flu season and jumping right into March. And so we're doing well, and we've got great healthcare workers in our state that are very committed to our patients across the state. So you know, we're constantly trying to keep morale high, and we appreciate all the donations and the well wishes. We get cards and letters every day here, Sam, and I can't tell you how much it's appreciated for our staff. But we're constantly out rounding and thanking them in many, many ways to keep this going.
What keeps you up at night?
Well, that's a tough one. You know, I just you never thought that we would be dealing with this. You know, in particular, you and I talked about UMC after October 1st, and I thought that crisis and incident was kind of a moment in time for us, but this has definitely been a much longer sustained battle. And trying to see the relief in sight has been a big challenge, but just thankful for my entire team, all those that work side by side here at UMC to take care of the patients. We've been doing it for 90 years and continue to show our commitment to our community.
Are you concerned with the volume of people visiting Nevada, Southern Nevada, from California and elsewhere now that the hotels are opening up? Does this concern you that this is going to increase the spread?
You know, I think it is, Sam, but I'm a firm believer we've got to open up. You know, we've got to build herd immunity. I can tell you, we've had the opportunity to work very closely with our resorts and our casino partners down on the Strip and throughout the community. And they've just done an amazing job of protecting guests, visitors, employees from the moment you walk into the resorts. And we've got great relationships. If a patient is identified or an employee, we quickly intervene with them. And so as we're naturally going to see things continue to increase as far as overall numbers, but we've done a great job of testing here in our state, I think better than many other states. But yeah, I'm a firm believer that we do need to open up and get back to normalcy as much as we can in a safe way. And our hospitals stand ready and our healthcare providers stand ready to take care of those patients. But that's kind of my thoughts.
We have many more topics, but we're out of time. So come back soon. Always appreciate you being here, Mason.
Thank you, Sam. I appreciate your checking in with us.
Thank you, and we'll be right back.
A bird's eye captures its surroundings at different heights. At Brian Culpa Photography, we can make your imagination soar over buildings, parks, cityscapes, and beyond. Brian's images tell the story and get the job done. If you need a new perspective to tell your story, contact Brian today. Brian Culpa Photography. Experience the bird's eye view at brianculpaphotography.com.
Hi, my name's Marilyn Miner, and I'm sure you'd agree that Nevada's a very special place to live. I was born here, and my husband and I have raised our family here. I feel it's a privilege to live and work in the Truckee Meadows. I especially enjoy helping my clients reach their real estate goals. Sometimes the smallest details provide the greatest satisfaction. I'd be complimented to talk to you about your next move.
Call Marilyn Miner at Dixon Realty, 742-1280, or log on to marilynminer.com.
Safety. We all think about it. You think about it when he buckles in, when you check your mirrors and put away your phone. RTC thinks about safety too. In fact, we create it. Center turn lanes mean fewer blind spots. Bike lanes keep cyclists and you safe. Roundabouts reduce injury collisions, and all these crosswalks are designed to keep families like yours safe. Safety is your priority, and it's ours too. Every day, in everything we do.
Pro Group Management specializes in providing industries with the necessary components to satisfy and exceed workers' comp requirements. Every business has unique needs and specific regulations. Pro Group Management stays ahead of the curve, providing up-to-date services to keep your industry in top form. Discover how we simplify your tasks, improve efficiency, and reduce expense to keep you moving in a positive direction. Pro Group Management, workers' comp that works for you.
You can now watch Nevada Newsmakers on YouTube. Just go to YouTube and search for Nevada Newsmakers and become a subscriber. We'll see you on the next broadcast. Thanks for watching and listening.